Imagine driving home, checking your mirrors, when the edges of your vision simply start to vanish. A creeping darkness moving inward. You can't blink away. That shrinking tunnel is the hallmark of glaucoma. Doctors call it the silent thief of sight because it operates without warning, quietly stealing your peripheral vision before you realize something's wrong. The damage begins deep inside the ocular cavity, far beneath surface-level components like the lens or cornea. A relentless internal pressure builds within the globe, crushing the eye's neural architecture from the inside out. To understand how this pressure builds, we have to look at the eye's architecture. The outer layer is the sclera, a rigid, interwoven collagen shell that acts as a suit of protective armor. But a human eye isn't empty. Beneath that tough exterior, the globe is filled with a dynamic fluid. Because that outer shell has very little give, the volume of that internal fluid has to be perfectly managed. This diagram shows the critical metric of a healthy eye. The internal environment must maintain a delicate equilibrium of exactly 15 millimeters of mercury. Hitting that precise number requires a continuous geometric balance between fluid entering the eye and fluid draining out. Because the sclera armor is so rigid, any disruption to this 15 millimeter balance immediately turns the internal fluid into a crushing physical force. To find the source of this fluid, we have to travel deep behind the iris. This image shows the ciliary body. It acts as a dense, heavily folded vascular factory that is constantly churning out a clear liquid called aqueous humor. If we zoom down to the cellular membrane, we can see the specific biological engines driving this production, enzymes like ATPase and carbonic anhydrase. This graphic illustrates a process known as hyperosmolality, which functions as a sodium magnet. The enzymes pull positively charged sodium ions through the barrier, which physically drag blue water molecules along with them to create the aqueous humor. This cellular factory has no off switch. It continuously pumps fresh fluid into a closed sphere, requiring an equally flawless drain. Once produced, the aqueous humor flows forward, passing through the dark opening of the pupil to fill the front chamber of the eye. This visual highlights the main drain, a highly porous, spongy microstrainer called the trabecular meshwork. The fluid filters through the white mesh, funnels into a circular pipe called Schlem's canal, and is dispersed out into the body's red episcleral veins. A secondary alternative overflow route shown here, the uveoscleral pathway, handles a smaller fraction of the outflow. This graphic brings the entire circuit together: production at the vascular factory, forward flow through the pupil, and dual drainage out into the vascular system. As long as the vascular faucet and the meshwork drain operate at the exact same speed, internal pressure stays balanced and vision is preserved. The onset of disease begins when this equilibrium fails. On the right side of this split comparison, microscopic debris and cellular gunk have physically clogged the pores of the trabecular meshwork. The ciliary factory continues to pump fluid into the chamber, but with the drain blocked, the internal pressure spikes violently. This mechanical failure transforms the eye into a microscopic plumbing disaster. The trapped fluid exerts a physical force that attacks the internal anatomy. Because the rigid sclera armor cannot stretch, the massive pressure of the trapped fluid is forced violently backward. This topographical map shows the impact on the optic disc. The tissue buckles under the weight, creating a deep depression known as optic cupping. Above, individual retinal ganglion cells are physically crushed, starved of oxygen, and broken into fragments. Retinal ganglion cells are part of the central nervous system and cannot regenerate. Once they are crushed, the vision they provided is gone forever. This entire process happens in total silence. You will feel zero pain and notice no symptoms until the outer edges of your vision have already been destroyed. Everyday medications, like certain over-the-counter decongestants or steroids, can inadvertently constrict these drains and accelerate the pressure spike. Routine dilated eye exams are the only way to detect this, where an optometrist physically measures the fluid pressure against the 15 millimeter baseline. If caught before cell death occurs, medicated eye drops can throttle the cellular faucet or chemically unclog the drain to restore equilibrium. The eye is a delicate sink. Blocked drains silently murder the optic nerve, and routine pressure checks are your only shield against the thief.